Good afternoon, everybody. Welcome to the February 16th Health and Human Services Committee meeting. We have a lot of stuff on the agenda. Many of them are smallish and quickish, but only if we make it so, only if we don't debate them endlessly. So let us try to move through the agenda crisply. Some things are going to take a little while, a little longer, goals and such, and let's do it. Okay, I have been informed there are no changes to the agenda that anyone's aware of. Is that true? Yes. Very good. And that there's nobody from the public here to make comments. Okay, look how far we're going already. Chair's report. I have nothing to report at this time. Lisa, County Administrator's report.
We are keeping it crisp today. I'll try to do the same. The only item I have is what's mentioned here under the discussion item, and those are the departmental goals, which are attached to your agenda packet, and they include all of the departments reporting to Health and Human Services. So I wasn't planning on going through each department specifically, but what we've done in other committees is this is an opportunity for you all to ask departments who are here any specific questions you may have about what they have listed on their goals. And again, the purpose of it being that so there's a good communication back and forth, and committee members understand what's on the workload and on the radar for departments, what they're looking to do in the course of the year, be it special projects or the day-to-day workload that they're involved in. And then it can also help you as committee members in creating the overall committee goals so that everyone is moving in the same direction throughout the year.
Great, thank you, Lisa. So we have an extensive list of goals from the departments. I just want to pause for a moment. One of these days, I'm going to figure out what percentage of the county's workforce and what percentage of the county's budget is represented by this committee, because it's very large, right? Department of Social Services, Health Department, Public Health, Mental Health, very big staffs. So it's a lot of people we're talking about, a lot of money that, and programs that are involved in this committee. So it's no surprise that the list of goals is very extensive. So are there any questions, comments, thoughts, suggestions, etc., about the departmental goals? Okay, well, this is not the last moment ever that anyone gets to ask. So they're going to be here all year. They're meant as a roadmap for the year. So anytime we want to focus in on anything, zoom in on anything, we can do that. Thank you, Lisa. Anything else?
I don't have anything. You can ask the departments who are reporting today any updates on their water situations in their various buildings, because a few of them here have been affected by the water main break in the city. But that's all I have.
Okay, that'll be part of our icebreaker. Every time someone gives a report, they have to talk about their water.
Perfect.
Okay, we're going to move on then to housing. Before we get to the actual resolution, I had a housing question for everybody. So we have a position in the planning department for a housing planner. I don't know if that's the exact title. And am I correct that that position is not filled at the moment?
That's right. Yeah. The person that was in that position left in December, and Katie and I are actually scheduled to talk with Ruby and HR tomorrow about both that and our other senior planning position, and kind of recommendations for how we might recruit, kind of those, since we've got those two open positions. One was focused on energy, one was focused on housing.
Thank you. So there's no real timeline at this moment about when that might be filled?
No, the conversation tomorrow, I think, will help guide our next steps. And I should say that both those positions are currently are technically senior planners. So though they're focused on certain things, it's not necessarily restricted to housing potentially. So.
Thank you. You might need to remind me and some other people as the year goes on, if I refer to them as a housing planner, remind me that that's not what they are. Okay, so in the meantime, though, you're the housing planner.
Yes.
Right? Okay. Is there anything you want to say before we get this resolution on the floor?
No, just this is a slightly unusual situation where we had an applicant. It's complicated, but ultimately this is the Ithaca Housing Authority and our public housing in part of the city. And they did not apply for the maximum they could have in their initial application. And as the memo explains, along the way, some other twists and turns came up where the committee felt it warranted increasing their award to the maximum amount to help leverage the state funds they needed to close those gaps.
Okay, thank you. Is there anyone that would like to move this resolution? Okay, Veronica, thank you. Moves it. Is there a second? Andy, thank you. Okay, questions, comments? I saw Ann's hand up. Go ahead, Ann.
Hi, thanks. I just wanted to say in general about the Community Housing Development Fund, to thank Megan for jumping back in to do all the work that's necessary. There's a ton of work for this group, and so we had our last meeting, and I was voted in as the chair of that. And so I will try and be here, even though I'm not on this committee, when something comes up from the Community Housing Development Fund, in case there's anything that I could add or support to anything that comes up. And also Greg Mezzi is on that, and Henry Granison. So either I or one of them will try and be here to help support Megan when these things come up.
Thank you, Ann. Okay, so we have this resolution on the floor. Is there any discussion? Veronica?
Thank you, Dan. About, this might be out of the purview of this resolution, but I have maybe a question about the project itself. I know that there's been concern from some of the North Side residents about the way this unit demolition reconstruction is going on. And that their own, there's not really stable alternate housing for them during this time. Do you have, Megan, I don't know how much you know about that, but do you have any update info on this?
If you give me one moment while I look, I think I was copying in on an email with the city actually on the relocation where necessary. I think because the construction's in stages, they've been trying to relocate people. Let's see. I can find it fast enough in my email. Otherwise, I'm happy to follow up with you all.
Maybe we can come back to you in a few minutes.
That'd be great. If you could give me a couple minutes, that'd be great.
Sure.
When we say North Side housing, are we referring to the housing complex on 3rd, 4th, 5th Street?
Yeah, so they're known currently as the North Side Apartments. So this is the public housing on the north side of town. There's another complex on the south side and
then West Hill.
Yeah, exactly.
Okay.
So this is only the north side's being reconstructed. I will say the county has a pilot agreement in place for all of the properties, except Titus Towers is not part of this overall effort by the Housing Authority. Other properties are being rehabilitated, and so they were not part of this grant application, only this demolition new construction piece.
I thought the residents that were in the north side were being moved to south side and West Hill.
Yeah, I just actually found that email. So the latest I'd heard is 16 households remain on the property. 8 have housing or are just waiting for a date to move. The other 8, they're still working to find housing. And this is as of late January was the email. Of the 45 who've moved or about to move, 4 became homeowners, 2 in Ithaca, 2 in surrounding towns, 12 moved to Ithaca Art House, 9 moved to various INHS properties, moved to Titus Towers. And then there are some other apartment complexes others moved to. And apparently of the 8 pending moves, 7 are to housing in Ithaca and 1 is deciding to move out of the area.
Great, thank you, Megan.
Other discussion about the resolution? Okay, we ready to vote? Okay, Travis.
Yes.
Yes. Veronica.
Yes.
Mike Sigler.
Yes.
Randy.
Yes.
And I'm a yes. That's unanimous. Thank you, everybody. Megan, anything else from you before we move on?
No, I'll probably be coming, I think next month with a couple more resolutions related to our most recent applicants and also the town of Dryden deciding to continue on as an associate member of the program. So you'll probably be seeing me next month.
Sounds good. Yeah, just as a reminder to everyone, housing is new to this committee, right? It used to be in the Housing and Economic Development Committee, which has been dissolved. So this element of housing is new to this committee. So welcome, Megan.
Thank you.
Okay, moving on then to public health and mental health departments. Frank, hello, good morning.
Hi, everyone.
Good afternoon, I guess. How's your water?
At public health, it's fine. Downtown, not as good. Pressure's back, so we have water, but it's the pressure's not great and it's a little discolored. So we provided bottled water for folks for drinking, and of course the bathrooms are functional. So we're still operational at this point.
Okay, thank you. All right, the first thing you have is an informational item. Does anyone have any questions about that? It's a transfer. Okay. Second item is resolution rescission of resolution 11, number 11 of 2022, appropriation from contingent fund in contract with Human Services Coalition for continued 211 COVID-19 response. Frank, did you want to say anything before we put this on the floor?
It's good news. We have state funding that's going to allow us to pay for this contract, so we will not need contingent funds anymore.
That is good news. Okay, is there anybody that would like to move this? Got Randy moving it, Veronica seconding it. Thank you. Discussion. All right, we're ready to vote then. Randy?
Yes.
Mike Sigler? Come back to you. Oh, there you go.
Yes, I'm sorry. Yes, Dan.
Okay, thank you. Veronica
Yes.
and Travis,
Yes.
and I am a yes, so that's unanimous. Thank you, everybody. Okay, the next one is authorization to accept funds, execute contract and budget adjustment, supplemental COVID-19 funding, Health Department, fiscal year 2022. Frank, is there an introduction to this one?
Sure. So this is $1 million grant that the state has provided to counties that were enforcing the mask mandate. And so this resolution accepts those funds and begins to put them on the books for expenditures.
So we'll also put this in the good news category, right?
Yeah.
Okay, good. Okay, somebody want to move it? Veronica, thank you. Travis seconds it. Discussion. Okay, let's have a vote. Travis,
Yes.
Veronica,
Yes.
Mike Sigler,
Yes.
Randy,
Yes.
and I'm a yes. That is unanimous. Whew. Zipping right through. Here we go. Here's something a little longer, I think. Next item up is an update on public health, mental health department merger. Frank, take us away.
Great, thanks, Dan. I thought it'd be good timing to bring to the committee as it's reformed with some new faces to talk a little bit about where we are in the merger process and kind of what we're expecting to have happen over the next few months, and then ultimately talk a little bit about how the committee wants to be engaged in this work as we move forward. As everyone's probably aware, just a little bit of history. Back in December of 2019, the legislature gave us formal approval to move forward with merging the two departments. We had an 18-month timeline to do that. Of course, in January, COVID came and things got delayed a bit, but we are back and ready to begin this process in earnest. And there has been quite a bit of work that's actually occurred over the last 2 years. Sometimes it shocks me a bit to see how much we actually accomplished on top of COVID and shifting to telemedicine and all the other adjustments that had to be made. But we've made the most progress in the merging of our administrative functions. So those kind of back office type services. We knew that that was going to be one of the quickest and I don't want to say easy because it certainly isn't easy, but it's definitely been something that we could get on quickly. We were also accelerated because we had several retirements with the retirement incentive in 2020 that actually allowed us to then do some restructuring more quickly than we might have otherwise been able to do. So that work has gone really well. And I think you all know, or if you're not, don't know or aren't familiar, Jeremy Porter is the fiscal administrator, and that is a position that serves now both departments. So he's generally providing oversight to all of the administrative work on both from both buildings. That really was kind of the first step of this reorganization within admin. And then underneath him, he's been able to recruit in several positions that are serving functions for the entirety of the new department. We hired a fiscal manager. Actually, it was an internal promotion that we were happy to be able to make. That person is now working on state aid and our county finances, such the budget and such, for both functions. So that's kind of a big step forward for us. And we had always imagined that there was some efficiency to be had and some expertise to be shared along those state aids and county budget lines. So we're excited to see that moving forward as well. We also have a billing coordinator position now that serves for billing for both departments. Mental health does a lot of billing. Public health does a little bit of billing, but we had to have staffs in both places in order to do it when we were separate entities. Now we have a team of people that are doing all of it together. So it's created both efficiency as well as redundancy for us. Before, if somebody left from either of the teams, it was really challenging because no one else really knew what they did. But now we have a team of people that are focused on billing, and it's all being done out of that single unit. We've been sharing a electronic health record for some time now, so that's not without its challenges. It hasn't been perfect, but it's definitely created some opportunities for us to work together and have support for a single unit for that electronic health record versus having multiple systems. We do have other systems. Our Children with Special Care Needs has their own system. Environmental Health has its own paperless initiative, but this electronic health record really is the largest of all of them that is allowing us to work more closely together. Our HR tasks have been joined. So all the different paperwork and processes for onboarding people and such are now centralized for both units, which has really created an opportunity for us to get more consistent and begin to start thinking about how we can improve those onboarding processes while we continue to do the day-to-day paperwork that needs to be done. Website development has been taken on for both departments by our health promotion department. So you may have noticed that the mental health webpage is starting to get a little more meat on its bones. One of the biggest additions was the Community Services Board and the subcommittee information is now located there. So those public meetings and the public documents associated with them are more available to the public. So we're excited to see that. And our public health website just migrated. I think we might have been the last department to migrate onto the new platform. And that really was due to COVID and the sheer volume of information that's now on that website. But we're excited to start to see that come together. And hopefully at some point in the future, we'll be shifting from 2 websites to 1 integrated website. Fleet management for both units is now under a single unit within the administration department. So they're managing the whole fleet. And we're also looking to have our support staff uptown in the public health building be able to support phone calls and other administrative duties for the downtown facility. We make a lot of phone calls for our mental health clinic. And we have a great team there that does it, but they need vacations and they're out sick sometimes. So having the ability to have additional admin support, be able to do some of that work is something we're looking forward to. COVID has really slowed that down because there's still quite a few phone calls coming to the health department for that. But as that starts to ease, we do think that there's going to be a lot of benefit for having additional support for that. And one example of really the 2 units working together is we have staff in our mental health clinic that created what we call a soft landing, which is an opportunity for anyone in the merge department to come and just talk about how they're doing. It really came out of the stressors that were being created because of COVID, both the COVID work and the adjustments to our regular work because of COVID. And so, we're very thankful that we have staff that have that type of expertise that have created a space for everyone to come together and share what's going on. So, I know it's kind of a laundry list of things, but I just wanted to let you guys know how much has actually been going on from that administrative merger piece of things, because it is a lot. And it really is making a difference for the folks that are doing that work. And I think for the larger department, as the service from our admin division has improved because they have more support and redundancies. So the next big thing for admin that you all will be a part of is the chart of accounts. So as we merge together, we'll be working with the finance department, county administration to figure out, in preparation for the 2023 budget. Unfortunately, that means we have to have it ready relatively soon because we're going to be starting that process soon, as Lisa keeps reminding us. So we want to have that chart of accounts ready to go. So when we're budgeting this summer, it'll be ready to go and start in 2023. I don't expect you're going to see huge changes, and you all probably won't notice much of a change because we're still going to have, the different programmings. We'll have a mental health clinic budget. We'll have a pros budget, and environmental health, children with special care needs and such. Those units will all still need to exist underneath this new merged chart of accounts. It's really at the top end where there will be some adjustments, and there'll also be time and service accounting that needs to be done for the folks that work in both places so they can be budgeted appropriately. So that work is starting, and hopefully we'll have some updates on what that will look like for you as we progress through that in the next couple of months. So that's the admin piece of things. There's been some other work going on as well around services and identity of the department. So as I hope you're all aware, we did also during COVID create a strategic plan for the merged department, and we have been working on implementing that plan. We created our first 2 what we call cross-functional teams, which are teams of folks from different parts of the two different departments coming together on a particular issue. And the first 2 teams that we formed, one was around identity, and the other was around service understanding. The second one had to take a little bit of a pause because many of the people that were on that committee were heavily involved in COVID work. But the identity team has been working really hard over the last 6 months or so and putting together a plan for how we develop a new name, logo, and branding initiative for the merged department. So I want to come back to that, but I do want to talk about the other team as well. So that the other team has made some introductory steps into helping us try to figure out ways to learn more about each other. And when I say each other, I mean us within the merged department. We don't all know what each other does. In order for us to be effective at figuring out how we can integrate services to better suit our clients, we need to have a better understanding of what each of us does so we can have some educated conversations. So there's ongoing work on that, and I think there's definitely some energy around it that now that people have a bit more time, we'll be getting that back up and running. We are also in the process of developing a third cross-functional team, and that one is going to focus on an actual integration of services. So looking at all of the children and youth services we provide throughout all of our programming and figuring out where there are synergies and integrations that can help both improve efficiency, but at the same time provide better service for our community and those that are seeking services from us. So those two are kind of in the beginnings and we'll be continuing to work on, and just wanted you guys to be aware of that. So I want to circle back and spend a little bit of time talking about the identity and branding team that's been working and where they are in their process, and then engage you all in where you might want to be involved. So that team spent a good bit of time trying to understand what identity and branding was. They talked with local professionals. They did research on their own. They did talk to some stakeholders about what that might look like and how we might get, the appropriate voices to that conversation. And ultimately, they were able to put together an RFP for a professional identity and branding organization to help support this work. And we are in the process of reviewing applications that came in, proposals. We've narrowed it down to some finalists. We did some interviews over the last few days. And actually tomorrow will be the team that's reviewing will be sitting down and settling on our top 1 and 2 choices before we bring those through the appropriate approval processes. So what that means is we're engaging an entity to help us develop a new name and a new logo, but more importantly, help us put together a branding plan. Essentially, how are we going to present ourselves to the public, as this new merged entity? Now, that process, there's a couple of pieces to it. The first is the name. I don't get to decide that. You all do. So the county department is created through the county charter, and the name of the department de facto is established through that chartering process. So ultimately, our goal is that we'll have a strong process that everyone can feel comfortable with. We'll come out with a final product, which will go to the Board of Health and the Community Services Board for their first opportunity to give it, their support if they so choose, before it then comes to you all for your final say on where we landed. We are trying to create an inclusive process. We've engaged the Board of Health and Community Services Board to provide representation to be a part of the team that's going to work with the vendor to do this. And we've committed to regular updates to both of those boards about the process. So that way, by the time we get to a closer to final product and we're bringing it for their review, hopefully they will feel comfortable with the process and be able to support the work of the team and what comes from the vendor. So that's where we are in that process. It will likely take anywhere from 3 to 6 months, depending on the vendor and how quickly we're able to move through that process. And so we're hoping to be able to start that sometime in March and begin moving that forward. So really my putting on the table for all of you is we would also like to have you engaged in some form in the process. So that way, when a final product does come to you, that you'll feel comfortable in the process that was undertaken and hopefully be able to support whatever was developed. So that's really what I had, Dan. I'm happy to talk more about that or answer any questions about anything that you guys have.
Thank you. Questions or comments for Frank? Frank, do you expect to be fully merged by the end of the year or not necessarily?
So the definition of fully merged is probably important. I think our goal is to have you all considering charter changes by the end of the year. So that there are some charter things that need adjusting. First of all, creating a single department instead of two. There's roles and responsibilities for me as the department head that we have to work on. And then there's the bylaws of each of the boards that needs some adjusting. So there's work, the boards are working on their bylaws now that will ultimately come to you all. And we're going to be working with the county attorney to kind of talk about that chartering process and what it will look like and what things we really need to be starting to hammer out. So that way we can bring, something to you all that makes sense and is legal, of course. So hopefully if we can get that part done and the chart of accounts in place for 2023, then yes, we're talking about, fundamentally being fully merged. If we're talking about the integration of all of our service to the full manner that we're hoping we're going to achieve, that's going to take a bit longer. And I imagine, our strategic plan was thought, has a 3 to 5 year timeline. And in that, it's going to take much of that time to be able to do the full integration that we're hoping we'll ultimately be able to achieve. So I think the short answer is yes, give us 12 to 18 months to kind of get the structure piece in place and be fully merged. And then we'll need a couple of more years after that from the service integration component to feel where we would feel comfortable saying we're fully merged.
Frank, is it too early to talk about when or if maybe employees might be switching buildings?
No, we actually were just talking about that yesterday. And that cross-functional team that I was talking about that's focusing on children and youth, we really think that has some potential for us to do some cross work from the two different buildings. So that I think will be the most visible and tangible thing for all of you in the community that sees as that work unfolds. And I'm hopeful we're talking about a 6-month horizon on that. That's kind of the working plan. I will tell you there are people working in both buildings now on the administrative side of things, but they're not really public facing or things that you all or our clients and participants would notice. So we're getting closer to it, and we're very much evaluating the space in both buildings now to try to figure out what's available. So as that team is working, they'll know what options are there for them.
Thank you. Any other questions, comments for Frank? Veronica?
Yeah, thank you, Dan. And thank you, Frank, for this update. I didn't know a lot about this going into this as well. So seems like exciting progress. One question is, how do you think that services delivered to clients are going to change? I know this might be way too premature because it sounds like you're building groups to talk about that, but
yeah, no, it's certainly not too early to talk. It's actually been kind of the foundation of what we've been talking about from the beginning. I don't know that I can give you exact specifics on how it's going to change, but what our hope is that as a merged department, first, we're going to have a better understanding of what we all do, right? And we're going to be able to have conversations about, okay, you're serving this person. And I say this person broadly, this group of people, this person that has this need, and so are we. And so how do we better, how do we first make it easier for them to access our services, right? So that's a component of it. Is there a single entry into everything that we do, right? If somebody comes into the children and youth program at mental health for services, how can we get them connected to quickly and efficiently to WIC? Or children with special care needs services if they need, developmental disability and delay support and such. So that's really what we're looking to be, is a single place for health services, and that everything that we provide is easily and quickly accessible to anyone, no matter what entry point they have to the new department. So that's the vision. And, that's the work that the teams will be doing over the next, several months and couple of years to kind of make that a reality.
Thank you. How are you taking input, or are you able to, from like people who are seeking services, whether they're succeeding or not at getting them?
Yeah, no, it's a really good question. And to be completely honest with you, we haven't been very good at that, right? We're really good at developing good, strong programs because we're professionals, we're trained in that, but we have not been very good at going to the people that we're serving and or people that we're not serving that need our services to hear how we can better engage with them, how we can better develop our programming. So that is a part of what we're building. Our health promotion program, thank you to the legislature, has added a couple of community health worker positions that we're hopeful are going to help us engage lived experiences that we don't have to help inform this decision making. And we're actually having this conversation right now about the identity and branding process, right? How do we engage the folks that are seeking service from us around this new identity, because that's really what our hope is for it, is that it'll be something that people can look at and engage with and feel comfortable coming to seek service from. So we're working on it. We're not perfect or really very good, but it is fundamental to what we're doing with this merger and our strategic plan is bringing other lived experience to the conversation.
Thank you. Good to hear you're thinking about that. And I was going to ask about the goals and the branding plan too, but I guess you just like mentioned that. My last question was just how you talked about the staff having a place to go to talk about how they're doing. How are they doing?
Yeah, I think like everyone else, we have good days and we have bad days. And I think and this was kind of a homegrown grassroots thing where we had some staff say, hey, is there something we could do? And then they were kind of talking to each other, and some of the folks at mental health said, sure, we could lead something. And that's kind of how it evolved. And I think generally speaking, folks are doing good. Good in that they're feeling like they're helping people that need help across the board. I think we're all wore down. There's no doubt. We're just like everyone else. We're tired, we're stressed. But I think we've tried as an organization to provide opportunities for folks to get together, be alone, do different things, to help deal with those issues as we go. But I'm hopeful. My hope is that as we're going to stop hopefully talking about COVID as much, we're still going to be talking about it for a while, but it's not going to be all encompassing, that some of these other things that we had a lot of energy around pre-COVID are really going to help, re-energize us and, as a staff to move forward and achieve these goals that we were all excited about in 2019.
Great, thank you.
Randy, did you want to say something?
Yes, Frank, thank you. I've been fortunate enough to get on many youth-related committees or boards. And so if you're looking for a legislature to be involved in that part of what you're working on, I'd be glad to give you my 2 cents.
Sure, we'll certainly keep that in mind.
Any other?
Go ahead, Dan.
Any other discussion?
If there isn't other questions, Dan, if I could just ask kind of a pointed question, we will ultimately be bringing this product that we get from the vendor for the branding to you all for your approval, and I just want to gauge your interest as a committee in, do you want to have somebody represented in the weeds of that process as it unfolds? Are you comfortable getting it at the end and being okay as long as the board and the Board of Health and the Community Services Board support it? Is there something in between that would be useful? I just want to make sure up front I'm engaging you guys appropriately, so when we get to the end, you feel comfortable in the process.
Thank you, Frank. I appreciate that question. Committee members, what do you think?
Can you say a little bit more about what the process is going to be? Like, suppose we weren't involved with it.
Sure. So we have the cross-functional team along with senior leadership in the department will kind of be the core team that's working with the vendor to get to know us, because obviously they have to learn about us in order to develop something. We have representation from the Community Services Board and the Board of Health that are going to participate in that process. So really what it is meeting with the vendor to talk about who we are and, you know, who we serve and what our vision and values are. And then it would be, you know, kind of reviewing product as they produced it and giving feedback for editing and such. And along the way, because there's the name, there's the logo, and then there's the branding. So those are kind of three pieces of three products that they will be, you know, providing to us, and they're going to need input along the way on that. There will be a time where we're going to have to bring things to you all for a vote, right? Because I have to have support from the legislature on what the final name is going to be in order for us to move forward. So that will formally happen no matter what. But the involvement could be anything from being a member of this team to us just coming to you each month or via email and explaining, you know, what's the progress of the team has been, to us just bringing you the final product.
And so
Yeah,
otherwise,
oh, sorry, go ahead.
sorry, you said at the beginning and I lost it. So otherwise the members of the team would be like this cross-functional team of like health and mental health. I don't know what to call it right now. I guess that's the whole point. Department employees. And that's it. And the contractor that you'll hire.
Yeah, and so what we're also talking with the contractor about is how do we get other voices, whether it be a focus group of existing clients or patients, and those type of things. So that's part of what we'll be working out with the vendors on how to do that. All of the vendors have been interested in that. So I don't know that we're going to have representation on this team so much, but we are very much looking for processes to be able to get that kind of feedback.
I guess my first reaction is if you just keep us in the loop and keep us copied on things as they progress in whatever you judge to be an actual meaningful advancement, I guess, something like that. That's my instinct. Other committee members' thoughts?
Okay.
I agree.
That sounds fine to me.
Is that specific enough, Frank?
Yeah, and just, you know, so you all know the Board of Health and the Community Services Board will be integrated into this process as your advisory board. So, you know, they'll have been in this, and hopefully they will be offering voices of support before it comes to you as well. So there will be representation of the legislature in that form in the process.
Great. Anything else from anybody on the merger question? Okay, Frank, before you go, just a couple of things. We're going to be working on our goals later on, and I have a draft document that the department heads have not seen. I intended to circulate it, but I did not. So I just wanted to tell you what the health department ones are that we have on our draft document. I don't think they're going to be anything to discuss very much, but so one is public health and mental health department merger. And our goal is just to monitor the situation and take actions as appropriate. The other is COVID, and it's what I wrote was presently most of the COVID information and actions take place at the full legislature meetings. The committee's goal is that we will stand ready to be involved in COVID management as appropriate. That
Sounds good to me.
general enough? And, yeah, okay.
Yep.
Okay, and then before you leave us, is there anything else you want to tell us about departmental reports?
No, I think I've taken enough of your time. I appreciate it. Thank you.
Good. Thank you, Frank. Okay, moving on to the next item, which is Department of Social Services. We have one resolution. Hello, Kit.
Hi,
How's your water?
how's our water? It's the question of the day. We have water, and I'm really pleased that we do. It's amazing what you miss when it goes away. It is unfortunately very murky, which I think is going to be the case for a little while. I talked with Arel earlier, and he anticipates that they're going to be working on the system for a while, but they were able to do a patch and get us water back. Unfortunately, by the time they did that, it was about midday or close to it. And we had already made arrangements to continue operations with people working remotely. So we had already sent people out because, you know, we have a good number of people that arrive early in the morning and weren't able to use facilities or have water for quite a while. So, so we do have water, and I'm really pleased about that, but I think we can anticipate that it's going to be a little bit, I think we are going to continue to have water, but it probably won't be considered potable for a while. So I've already informed staff and let them know that they should plan on probably, you know, bringing some bottled water with them tomorrow, and we may need to look into a supply of that. So, so we're doing okay, and we were able to arrange to keep our primary operations continuing. One of the, you know, I don't in any way want to sound grateful for the pandemic, but one of the side benefits that we've gotten from the pandemic is that we've been able to really learn to mobilize quickly and continue operations even when we can't be on site. And there's a benefit to that. And we used that this morning. So so that's where we're at in terms of water.
Okay. Thank you. Okay, you have one resolution here today. Is there anything you want to say about it before we get it on the floor?
We do. And Kate and I will kind of collectively do this. So this is the Social Services and Youth Services Safe Harbor money. We receive this money from OCFS, the Office of Children and Family Services at the state. And this is pretty much on the social services end of things. This is pretty much a pass through. And then it goes to youth services, and I'll let Kate jump in here and kind of talk a little bit about the programming that they do with this money.
If I can get myself unmuted. Thanks, Kit. Yeah, happy to jump in. So as Kit mentioned, this is our safe harbor funding. Bridget Nugent, our deputy director, serves as the CSEC coordinator for the county. And so through these funds, we do some awareness campaigns, education, outreach, build partnerships. We typically, in a large chunk of this flows through to the advocacy center, and they do a lot of work around youth individuals who have experienced sex trafficking or are at risk of experiencing sex trafficking. And so that's sort of this has sort of been a 5-year grant that we had. We were anticipating that last year's funding would have been our last year's. At the end of 5 years, you move to what they consider to be a graduated county. And so we had been told that was going to be the case, and we weren't going to be receiving funding. Unbeknownst to us, we did get a notification get forwarded along to us that we were going to receive this money. And so this was a surprise, but it's a really great surprise. And so we have, again, through Bridget, have been working with our community partners to continue that education piece, to continue the campaign awareness, working with Cornell, and again, really partnering with the Advocacy Center to get this out and get this to the populations that need it the most. And so that is what this is about. So we're happy to have the opportunity to continue with this funding and doing some good work in the county.
Great. More good news.
Yeah.
Keep it coming. Okay, so the resolution is budget adjustment, social services and youth services safe harbors. There's somebody that would like to move that, please. Travis moves. Veronica seconds. Thank you. Discussion. All right, we're ready to vote. Oh, sorry, go ahead, Travis.
I just was going to say, I've been extremely impressed with the work that y'all have been doing with CSEC. It's been amazing. I have a staff that's involved, and the work is incredible. And I don't think people really understand where we are in this community with this issue. And I just want to thank you for this work.
Sure. Thank you for that support.
Thank you. Any other discussion? Okay, let us have a vote. Mike Sigler.
Yes.
Randy.
Yes.
Veronica.
Yes.
Travis.
Yes.
And I am a yes. That is unanimous. Thank you. Kit, before we let you go, do you want to tell us any other departmental updates?
Sure. So I would say the primary thing that we're doing right at the moment is really working on digesting some of the information that's coming down as a result of the governor's proposed budget. We just had our our association's conference at the end of January, and really are working right now on trying to figure out what are the next steps with some of the big initiatives. We've been working with the Child Care Council and trying to look at changes to our child care block grant and the way that we administer that, and really trying to work with OCFS around looking at how we can take steps to increase accessibility to those funds and to that benefit for people. So that's kind of a process. That's kind of something very much in process. I don't have concrete things to note right at the moment, but we are working on that to try to look at how we can improve things there, and as much as possible, kind of anticipate that with the governor's proposed budget passing, that there will be some changes that happen at the state related to that. So we're hopeful about that. Certainly the biggest challenge to all of that right now is the continued short supply of childcare placements. It's one of those things that we're trying to make more accessible to people and trying to figure out how people can use the subsidy. But if there aren't adequate placements, that's a kind of a self-limiting phenomenon. So we're working on that, taking steps around that. We are also, as I indicated in the goals, we are seeing some really significant changes at DSS, which we have known were coming. But there's some things that we've been doing to kind of anticipate, and some things that we have to kind of wait until the day is here. And unfortunately, some of those days are here right now with retirements and looking at succession planning. We have 3 or 4 people that we know are going to be leaving after 30 to 35-year tenures, and it's going to mean big changes. So we're really looking at how do we keep operations going? How do we stabilize? How do we make sure that we are taking the steps that are needed to kind of put things in place so that we can accommodate those changes? So that's a big planning process, and it's a process of accommodating those changes and those transitions. And then, the other significant thing that we're seeing right now that we haven't been able to completely assess it and make sense of it, but we are seeing rising caseloads, especially in our SNAP division, but our HEAP and our TA as well. I think that in general, that's a good thing, because I think that we know that with the eviction moratorium dissolution, I think that we know that people are in need. And so I'm glad that people are reaching out. But we also are trying to figure out how to help people in the ways that we can. And I think one of the challenges right now is that, with the ERAP program having ended, we're trying to figure out, how are we going to help people the most that we can with the housing challenges. And again, the greatest challenge is just that our supply of housing is short for what people can afford. So it's kind of a juggling act, trying to figure out how to help people in the best way we can. So those are just kind of some updates. That's where we're at as a department.
Thank you, Kit. Questions or comments, discussion for Kit? Okay. Kit, are you going to stick around for our goals discussion later on?
Sure, absolutely.
Thank you. There's a lot of overlap in our topics into your departments. Okay. Moving on then to Office for the Aging. Lisa, hello.
Hi.
How's your water, Lisa?
Oh, our water is okay for the moment. I think we got pressure back right around 11-ish, but so we're good to go. I'm sure as they continue to work on it, we'll prepare everybody to bring water as it might get murky, but it's actually clear right now, surprisingly.
Hard to understand, just a block away, right? From
Yeah.
Okay. Okay, let's see, we have 2 resolutions. First one is budget adjustment, project pause for Parkinson's disease, Tompkins County Office for the Aging. Lisa, do you want to say anything to introduce this one?
Sure. So this was, this resolution was already, the grant was already accepted through another resolution. Really, we were unable to get the project started because we're working with college students that went home early last semester. So it kind of put everything ironically on pause, as the project is called Pause for Parkinson's. But we were unable to get anything going until the students came back. So we didn't expend any funds. So we had to move those funds from 2021 to 2022 to continue the project.
Great, thank you. Is there somebody that would move this resolution? I've got Travis moving, Veronica seconding. Thank you. Discussion. Okay, let's have a vote. Travis. Randy.
Yes.
Veronica.
Yes.
Mike.
Yes.
And I'm a yes. That is unanimous. Okay, and we have another resolution from COFA, budget adjustment, Tompkins County Office for the Aging, CARES HDC 5 grant. Lisa, you want to start us out?
Yes, so this was funding that we had provided for FoodNet to continue their operations and to actually build space for their employees to be able to come back to work. And things were ordered in 2021. However, because of all the shipping delays and whatnot, they haven't received everything yet. So we were unable to pay them. They still haven't received it. So we had to move that money over to 2022 as well.
Very good, thank you. Can somebody move this resolution, please? Randy moves, Veronica seconds. Any discussion? Okay, let's vote. Veronica.
Yes.
Mike.
Yes.
Travis.
Yes.
Randy.
Yes.
And I'm a yes, that is unanimous. Lisa, anything more you would like to tell us about your goings on in your department?
Sure. I did just want to say thank you for supporting the resolution for Fair Pay for Home Care Act. And thank you, Veronica, for bringing that forward. Can I add a clarifying thing? I was listening last night and I just wanted to add a point if I was able to do that.
Of course.
Okay. So, although this bill does directly address the Medicaid reimbursement, it would really ultimately benefit all the payer sources as well. Offices for Aging, we provide services to people that make too much for Medicaid, our home care services, that is, but still need assistance paying. So there's not a select group of aides that only work with Medicaid clients. So Offices for Aging, private pay, managed long-term care companies, we all contract with the same licensed agencies for the care workers to serve our people in Tompkins County. So, where we're contracting with these agencies, we're paying up to like $28 an hour, but the aides are making about $13. So these licensed agencies really need to juggle all these various payer sources to create a rate of pay. So the Medicaid rate keeps dragging that down. So basically, these shortages are driven by lack of money in the Medicaid sphere. So but it crosses over into other populations too. So it does really affect all of us. So it's not just, changing it for Medicaid. It would supplement what we're doing too. And really it's a cost savings. I feel like, in my opinion, if this is done wisely, the bill would pay for itself. I mean, if we're keeping people in their homes and communities where they want to be at a lower cost, I mean, it's an overall cost savings for the state and not putting people in, Medicaid funding nursing homes. So that's all I wanted to say about that. And the other thing I wanted to mention, I think I mentioned to you, Dan, that we dissolved our COFA Personal Emergency Response System Advisory Board. Really, through the pandemic, we weren't able to really reconvene well. I checked with Kathy Covert, and this is not a required board. It's really leftover era from when PERS was handled differently in our county, when the county didn't have a 911 center and centralized dispatch, and there was a lot of parties involved in it. But we now have a contract with Doyle Medical Monitoring, and we use, we abide by the contract, and we have a solid outreach plan for that. And we'll continue to report out the demographics and the fiscal reports on a quarterly basis to our COFA advisory board. It just gives everybody one less meeting to go to.
Good, thank you.
You're welcome.
Lisa, I'm just jumping around a little bit. When we get to our goals, the goal that involves your department, our goal is home health aides. And I know you and I had a long, good talk about this, so I know you're informed about this, but I'm just mentioning it for everybody's sake. That's going to be the one that interacts most with your department.
Great.
Okay, so we are going to keep going. We are moving on to Youth Services Department. Hello, Kate. Hello again, Kate.
Hello, how are you?
Kate, how's your water?
The same as Kit's. So I think we'll bring some bottled water with us tomorrow morning and be good to go. So so we're bringing just before you a report and discussion to kind of update you guys on the runaway and homeless youth RFP process. Just to give a little bit of context, this was a program that involves an interim host home model, which was operational in our county until the end of 2020. It was operated by Family and Children's Services. Due to some of the impacts of COVID and capacity issues, they made the difficult decision to close that program. And so this has been a hole in our services provided, particularly to the youth that are younger, 11 to 18 years of age. And so tried to find a home for that. There was some capacity issues around the ability to sustain this really important program. And so the county legislature, through the 2020 budget process, was able to provide our department some additional funds. And so in November, after that budget was passed, we went back to the community with an RFP that was released in November of 2021. And put out really in a total RFP was worth about $153,000 and really was a 365 24/7 program that offers intensive case management for families, reunification focus. And then in situations where needed, this interim host home model would be a part of that. We did receive 2 applications. It was sent out community-wide to everyone in Tompkins County. We received 2 notifications, one from Family and Children's and another from another local service provider here in Tompkins County. Our resource allocation board, which are made up of members of our youth advisory board committee, reviewed the initial applications, the bids that came in at the end of December. They had some additional questions at that point around some of the specific needs for this particular marginalized youth high-risk population, around the issues that have resulted in the need specifically around COVID. And so they went back to the 2 service providers that had submitted their bids, gave them a couple weeks. Those came back in January. There's some really good conversation. Our resource allocations committee has agreed to award the contract, the bid, to Family and Children's to reopen the Open Doors program. Total grant is about $149,500, which is a combination of state aid and local funds. Some of the rationales that I wanted to highlight for you guys in that decision was Open Doors has a lot of experience in this area since they did operate the program previously. And so the ability to hit the ground running was really important, and sustainability for that we felt would be really important. They have the financial viability to continue the staffing. They're dedicating 2 full-time individuals to this, along with Mike Ellis, who is the program supervisor, who's a licensed therapist, who will be providing mental health services as well as providing other services, partnering with the Village of Ithaca, Learning Web, and the local school districts and other things to boot. So they've got really good wraparound services that they're going to be able to access. And I think that given the mental health needs that we have seen of youth that have been drastically on the increase since COVID-19, that expertise has been really, really important for families and the youth in Tompkins County. And then lastly, one of the really cool things that we were excited about in the bid that came from Family and Children's Services was they intend to hire some members of our local YAB board, which is our Youth Advisory Board, which was created off as part of the YHDP, which is the Youth Homeless Demonstration Project grant that Tompkins County received. Some of those youth are going to be involved in peer advocacy and advertising the program to make sure that we're getting out and really reaching those populations that need it, and creating a feedback loop to allow some flexibility and making sure the programs are relevant and we are providing top quality services to our youth. We're anticipating with Family and Children's, the interim host home model is licensed through the Office of Family and Children's Services. We have a meeting this coming Friday to talk about that licensure and getting that off the ground. Family and Children's believes that they can get these 2 full-time individuals hired and some of these needed services back in the community by mid-April. And so we're really excited to be able to just kind of update you on this, and thank you for your support, and we'll keep you updated on that as we move through this process.
Thank you, Kate. I know that the gap, the lack of this service last year was a concern for you, for everybody. So it's nice to hear that we're on a good track again.
It's good news. It's really good news. So we're really grateful for the support and happy to see this coming back.
Questions or comments for Kate? Kate, can you remind us what the age group is that's eligible for this program?
So this particular program will focus on 11 to 18-year-olds. So it really does focus on middle school, 16, 17. So not old enough to be still considered a minor, and hopefully preventative before larger issues sort of transpire in the youth and the family. So.
Thank you. Any other questions or comments for Kate about runaway and homeless youth and the new program? Kate, is there anything else from your department you'd like to tell us about?
Yeah, so just a couple things. We are looking for and have been advertising for a while, but are really sort of turning up the heat, looking for a youth representative to represent Tompkins County on the Governor's Youth Council. We're looking from anyone from the ages of 13 to 21. There are 18 counties that make up our residential. Brian Chetney is a colleague of mine out of Oswego County, is the lead on that. The last young lady we had was out of Dryden, and she has stepped off and finished her 2-year term. She's gone to Harvard. So we are looking for a youth who would be willing to step up and really just sort of represent us and be able to shape some of the policy around youth that goes to the governor's office. So if you know anyone or have any leads on that, I'd be happy to follow up on that. So your help in that would be really awesome. And the other thing is our youth advisory board, we're working to complete our RFP for our next round of funding, which will come out in 2023 for 3 years with an option to extend twice beyond that. And so we're getting that ready to go, and we'll be releasing that in the next month or so. So busy time for us.
Kate, if you want to send us a paragraph or more about the person you're looking for the Governor's Council to the legislators, I'm sure we'd be willing to circulate it among our networks.
Sure, happy to do that. Thank you.
Yeah. Any questions or comments or discussion with Kate? Okay, thank you very much. So let's see, the next agenda item is departmental updates. So I think there's a few departments here we haven't heard from yet. So how about Ken Clark? Welcome and talk to us.
Okay, good afternoon.
Yeah.
Hello.
Just a couple of updates for us. On February 5th, we celebrated the Human Rights Arts Competition Award winners. This year, given the reality of the pandemic, we had fairly low numbers in terms of participation from the schools and fewer schools than we've had in the past. Last year, we did not hold the competition at all because of the pandemic, but we did get some very good entries. And we had the awards event on Zoom on Saturday, February the 5th. We had about 50 people who viewed the live event. And as of the last time I checked, we had I think, over 90 views of the event overall. And we featured students' artwork and poetry on a PowerPoint. And so this is the first time that we did this as an online event, but I think it went well. And I'm grateful to our staff, Carmen Arroyo and Lourdes Cabrera, as well as Dominic Recchio, who provided the technical support for us. And as you know, one of the significant prizes that is awarded during this event is the Dorothy Cotton Poetry Prize. And so we co-sponsored with the Dorothy Cotton Institute to select that winner. And so we had, I think, a very good event, and we will continue to assess this event. And hopefully we will be in a different space next fall when we begin to make those contacts, really actually late summer, I should say, late summer with teachers in order to encourage further participation. Meanwhile, our Human Rights Commission has begun an initiative working with 5th and 8th graders on human rights awareness, and they have visited several schools in the district with a plan to engage more schools as well. And so this is one of a number of initiatives that the commission has taken on. And I think in that way, that can also help to fill some of the gap that may have been left by the low number of entries that we received for the competition. We are currently planning 2 events, upcoming events. We will be hosting, and we will have a date finalized by the end of the week, and we'll begin to get publicity out on this. And it will be a Black History Month panel, and it will be called Black Perspectives on What Ithaca Needs in a New Mayor. And so this program seeks to address themes informed by local challenges such as institutional and structural racism, affordable housing, recent eviction hearings that have been taking place, as Kit mentioned, or I think it was Kit or Lisa mentioned. It was, the end of the moratorium on evictions, and that has, created some stressors. And we also are taking into consideration as we raise this issue, this larger backlash of racism in the broad society. So we will be getting publicity out on that shortly. We are also planning an event in March, which we're calling Critical Race Theory, Fact and Fiction. And I am in process of contacting several experts, in particular with an emphasis on lawyers, given the fact that critical race theory originally emerged out of law school curricula to address and to critique some of the shortcomings of liberal approaches to social justice, and to look at the realities, the ways in which racism is embedded in the structures and institutions of the society. That's what it is properly understood, but there's been a great deal of distortion about what critical race theory is, and a great deal of mislabeling. So we are seeking to address that in this program, which will be held, we anticipate, in mid-March. And so those are some of the things that are going on for us.
Very good, thank you. I just wanted to ask the poetry and art competition, are the winners in a form that you can share easily, that we can see? I don't mean right now, I meant.
You can actually see the event and the artwork, the winning artwork, on our YouTube page.
Okay.
So the event is housed there.
Very good, thank you.
Sure.
Other questions, comments, discussion for Ken? Okay, well, thank you very much for joining us and reporting.
You're welcome.
And we are moving on to J.R. Claiborne. Hello, J.R.
Hey, good afternoon, everybody.
Good afternoon. You know, I forgot to ask Ken how his water is. And J.R., I'm not going to pass you up. How's your water?
My water is still cloudy, but I had the advantage of taking my staff home, telling my staff to go home and do work. So
That must have been big. Must have been a lot of coordination.
It is, right? A lot of calls this morning. Yeah, our water is still kind of murky at home, so I'm waiting on everything to clear up. But yeah, thank you and welcome to new folks on the legislature. I know I haven't gotten to meet everyone new yet, so I'm looking forward to that. And just in a way of kind of updates, just give a real short overview, which is basically that my department is responsible for connecting our local veterans community to eligible benefits on the federal, state, and local levels. Also trying to do referrals for those that maybe there are local organizations and resources that are more appropriate for their needs. I have a veterans population of approximately 4,100 veterans in this community throughout Tompkins County. I know that number is a plus and minus, but some days it feels like there's quite a bit more. I've been involved with my department, I should say, is involved in a number of projects. One of the bigger things right now is that the New York State Division of Veteran Services has embarked on a monthly training series on various topics, which is being pretty thorough on things that we have that we get to learn about. But also I've been attending the meetings of a couple of our local veteran service organizations, and I'm looking forward to, as COVID seems to go away or get under control, whatever we want to call it best, being able to do more outreach with our local veterans organizations. I've been pretty active with them of lately, and I've been really appreciative of their cooperation with trying to get their, help them with the distributions of masks. And today I just picked up the test kits that I'll be getting out to those that haven't signed up for the list yet. So that's been taking a little bit of work than I thought, but it's definitely something that's been good to do. So anything that's helping our veterans community benefits our overall community in that way. Also, I think I haven't told this group this yet, but I just saw something today about the point in time count and the Secretary Donahue of the VA having gone on a point in time count route in, I think it was in California where he went. And I did that here locally as part of the group, the team of people who went out on our local point in time count. And for those of you who are not familiar, that is the annual census of our local homeless population. And for some reason, it doesn't matter when we do it. We're supposed to do it in late January. We've moved the dates around a few times over the years, and it always seems to be the worst day of winter each year. So this year held true to that. It was a very bitter night. I think that was when we were in the sub-zeros temperatures. And we went all over looking for people. Our teams did actually find a few people in places. The team I was with did not, but it's one of those things that really hits home for you to know that some of the situations that our people have to deal with, particularly our homeless population. And for me, especially looking for our homeless veterans. One of the things that's kind of the highlight of my department is doing hosting twice monthly the Warrior Writers Group, Tompkins. And what that is, a group of veterans who currently range from the Vietnam era all the way through to the just finished Afghanistan, wars in Iraq and Afghanistan. We pretty much, we meet, we write to a prompt that is provided by a facilitator. The prompt is usually based on a published work by sometimes a local veteran, but a veteran out there. It might be something in the news. We write about what that experience is in accordance with our own military service, sometimes our own life. And then we come together and we share. We write about that and we come together and share. Sometimes it provides a good moment of catharsis for some things that may have been suppressed over years. A lot of times it's really a good bonding moment because everybody gets to share some things that are pretty personal sometimes. But it's been a good experience, and I'm glad to be able to host the group. My the one thing you'll probably hear me talking about once it happens is I've in the process of hopefully getting my what's called my PIV card, personal information verification card, I think is what it is. And this is something that will allow me to be able to serve our veterans community better because it will patch me directly in with the VA system, VA's claims record system. So currently right now, I don't have that. So I have to call one of my other colleagues to help me look up information specific about veterans. This will allow me to do it myself. And I actually am looking forward to it because it's going to be something to augment what I offer our veterans under my dual accreditation, which right now is under the American Legion and the New York State Division of Veteran Services. So I think that's everything on my plate, except next month, I am involved with helping coordinate a Cornell, it's called the Cornell Veterans Resource Fair. That'll be held up at Cornell, and it's involving a lot of organizations around, both in Tompkins County and outside of Tompkins. And this is being done with the, it's being led by the Binghamton Veterans Center and also support with Cornell Student Veterans Program.
Thank you, JR.
Okay.
Questions, comments for JR? All right. Thank you.
All right.
Good luck out there. Okay, we are moving on to advisory board appointments and liaison assignments. Katrina, can you clarify for me, for everybody, I guess? So we have a report discussion, and then we do the appointment. Are we just appointing certain things? The liaisons do not, you know, are we appointing everybody at once, or liaisons don't need appointments? Or
You
what?
can appoint everyone at once.
Okay.
You can go through and just.
So it's separated into two things because first we talk about it, then we actually vote on it. Is that?
Well, the advisory board appointments is actually the advisory board, the Board of Health.
Oh, yeah.
The liaison, the report and discussion item are the legislative liaisons and appointments.
Thank you. Okay, so first up is committee and liaison assignments. So I have reached out to all of you to ask what you were interested in. And so one really good thing that happened was nobody asked for the same assignment. So that's very convenient. Didn't have to choose between anybody. And then we've got a couple that haven't been chosen by anybody yet. And what I'm going to suggest is that we just offer that to other legislators outside of this committee. So let's go through them, just run through them and just make sure I have everything right, or if anybody's changed their mind, or if anybody has motivated to suddenly take on a new one. I've got Recreation Partnership. I've got Randy Brown. I'm going to jump to the other page. Alcohol and Drug Council of Tompkins County, I do not have anybody yet. Community Mental Health Services Board, I've got Veronica. Health Planning Council, I guess I will go ahead and do that one. Homeless and Housing Task Force, I've got Travis. Office for the Aging Advisory Committee, I was going to take that one too. Senior Citizen Council Lifelong, I don't have anybody yet, and I'll come back to that one in a minute. Tompkins County Youth Services Board, I've got Randy. Human Rights Commission, I've got Veronica. Human Services Coalition, Travis, I never circled back to you on this one. You said maybe. What do you think? Is this something you want to do? Is that a yes? Okay, very good.
Trying to grab this mute button. Yeah, I'll do it.
It is 8:30 in the morning. I don't know how you are in the morning. I was on this for 1 year. They did serve coffee, just whatever it's worth. Okay, so let's see, jumping back to the other page now. Greater Ithaca Activities Board, I don't have anybody at this time. And then we've got 3 of them that says no appointments necessary. In other words, for the most part, it's people continuing. So Sean is continuing on the Board of Health. Personal Emergency Response Service Advisory Board, we were just updated before that we're eliminating that board. And then the Community Housing Development Fund, we've got Henry and Ann and Greg Mezzi. Okay, so I had asked a question to try to understand what it meant, these liaison assignments, and what if we don't assign anyone to them, and where did these assignments come from, and what are our obligations? And the best answer I can find so far is that there's no obligation on our end to actually fill these. So that is one option, that if something's left unfilled, we do not need to take any action. The other thing that I said, which I would like to do, is offer them to other legislators to see if there's anybody outside of this committee that wants to fill them. And I guess I'll just leave it there for a minute. So let me pause there. What do people think about that? Is that first of all, is that okay that we offer these to legislators outside the committee? And does anybody have any specific thoughts about any of the ones that are unfilled?
Just to be clear, the three we're talking about are the Alcohol and Drug Council, the Lifelong Senior Citizens Council, and the Greater Ithaca Activities Board.
Yes, correct.
Okay. And follow-up question, I possibly don't know what the Greater Ithaca Activities Board is, and how does this intersect with the Greater Ithaca Activities Center, as in Travis's employer?
It's our board. And so we have a nonprofit side. And so our board of directors is our nonprofit side board.
Okay, so I assume you can't be on it.
Absolutely not.
Yeah.
And then the other thing I would ask you to consider, and there's no decision necessary at this time, but I've been thinking about, what value do we add to these committees and boards, and what value does our being on there add to the legislature? And so that's just something else we can consider as we decide to either, volunteer for one of these or not, or if we end up leaving some of them unfilled. I think it's a valid question. And like I said, no decision necessary, but does anybody have any thoughts about this before we move on?
It makes sense to me, and I think offering it to the legislatures, if they're interested, is a good idea.
Okay. Okay, well, one thing I would ask of all of you is, as the year goes on and you have experience working on these liaison assignments, to consider that question about whether you feel like it's a worthwhile thing for the legislature to be putting time and resources into. I have no way of knowing if I'm not on those committees, so I'd like you to report back at the end of the year. How about we say that? Veronica.
I'd be happy to also serve on the GIAC board. And to your other question, I wonder if you or Mike maybe wanted to say more about the value of, I guess you already did the liaison appointments, because I have no idea, having no experience with this yet.
Mike Sigler, do you want to comment?
Sure, I can comment on that, Jen. I think now that we're moving back to in-person on a lot of things, I think the value of these different liaison appointments actually improves quite a bit. I would say that in a Zoom meeting, I don't think that they're actually as valuable. And let me just explain why. I find that a lot of times I will go to a liaison appointment and I'll be chatting to somebody. And it'll totally be a side conversation to whatever the news of the day is that we're actually talking about at the meeting. And it's that side conversation that I find valuable and that I actually can take some new action on. So, like if we're talking about homelessness, right? I was talking to somebody about homelessness and I said, a great idea would be a mobile shower. I've seen this in other cities where they take a shower with, say, 6 stalls, and you go, you literally are just offering somebody a hot shower and maybe a way to wash their clothes. And I've seen that done in certain cities. It's made such a difference. It's not something that's all that expensive, I don't think. But that all kind of came from a side conversation. It's something I'd like to see us in this county do. But so it's that kind of idea, and I think that's where the value of liaisons come into play. And I think that's why now that we're moving into person, they'll become more valuable as we go forward.
Okay, thank you, Mike. Okay, and Veronica, I think I heard you saying there you'd like to volunteer for the GIAC board as well. All right. Very good. Okay, so we're all set then on committee and liaison assignments. And then we have the advisory board appointments.
I do believe we have to have a vote on Recreation Partnership Board and GIAC, just because those are actual appointments to boards.
Okay,
We'll have to do a motion.
okay.
Roll call.
Is there somebody that would move the appointments to the rec partnership and the GIAC board? Randy moves. Veronica seconds. Any further discussion? Travis,
Yes.
Veronica,
Yes.
Mike,
Yes.
Randy,
Yes.
and I'm a yes, so that's unanimous. Thank you. And then we have the advisory board appointments. We have to the Board of Health, Dr. Edward Koppel, physician representative, and Sue Merkel, at-large representative. And then to the County Office for the Aging Advisory Board, we have Patricia Young, I'm not sure, from Ulysses, and Lori Holtzberg from McGraw House representative. Is there somebody that would move the advisory board appointments, please? Veronica moves. I get a second? Randy seconds, thank you. Any discussion we need to have? We are allowed to go into executive session for appointments if we need to. Somebody would just have to say that. I'm guessing we don't. Okay, let's have a vote then on the advisory board appointments. Randy,
Yes.
Mike,
Yes.
Veronica,
Yes.
Travis,
Yes.
and I'm a yes, so that's unanimous. Very good. Okay, we have minutes approval from January 12th. Is there somebody that would move that, please? Randy moves. Veronica seconds. Any discussion about the minutes? Okay, let's have a vote. Mike,
Yes.
Randy,
Yes.
Travis,
Yes.
Veronica,
Yes.
and I'm a yes, so that is unanimous. Thank you. Comments from committee members, liaison, okay. So this is the point on the agenda where any committee members can mention anything they want to mention, including liaison appointments, reports, which I'm sure you don't have today. Anybody got anything they wanted to mention today? Okay, no problem. Okay, their last big thing then is the goals. So I had circulated goals, but I'm not sure I circulated them to everybody. I definitely circulated them to committee members, and I circulated them to other legislators. But I don't know. Lisa Holmes, did I circulate? Did you see a copy of this? You did. Okay, good. Glad I did that. I intended to get department heads into, but I didn't do that. I know that. So what I want to do is to go through these goals. You've all seen them, about a week ago. So you've had a lot, you've had some time to absorb them. I don't want to spend a lot of time on each one unless we need to. What I did was I wrote up a couple of paragraph or two about each thing, but we're not here to debate that. I was just trying to give a little bit of context for it. And then I pulled out a goal. I really liked what Deborah said last night. Well, let me back up a sec. I've always been a little uncomfortable with the goal setting activities. I feel it's a little bit, I'm going to say artificial. I like what Deborah said last night when she called them focuses. That just felt a little better to me. So I don't mind using the word goals, but my point is that this is not a rigid document. This is not, this is what we will do today. This is what we'll do next month. And if somebody brings something up that isn't on this list, I'm never going to say, no, we can't talk about that. So that's my only that's what I wanted to say about my feelings about the goals. This is just some guidelines, some thoughts, some structure. I also wanted to mention that last week I sent this out to all the legislators and invited them to comment on it and add if they wanted. And 2 other legislators did just within the last 24 hours. So nobody else has seen this yet. It's just me. So I'm going to add those on at the end to talk about. I'm not sure they're actually goals, and we can talk about what that means. Okay, so the first one I put on there was childcare. This had also been in the, if I'm not mistaken, this had mostly been in the Housing and Economic Development Committee last year. So it's newish to this committee. I think we've probably done, dabbled in it before. There's a lot going on. There's a lot of grants being sought, a lot of potential money coming in, a lot of projects. Does anybody have anything they want to say about the child care goal? So let me just read the goal. The goal says, we will have a general presentation on the state of child care in Tompkins County and will follow up with updates and actions as appropriate. We will monitor several large child care funding opportunities and assist as appropriate.
That's good. My only other thought on that was understanding what it takes to be approved as a child care provider on a small level or a large level. I'm not sure I understand that completely. My wife ran daycare for 15 years, but life has changed a lot in the last 15, I'm sure.
Okay, we'll definitely make sure you get that question answered.
Okay.
I spoke to Melissa Perry from the Child Development Council. We had a good long conversation, which is where all this stuff came from, where the context for the goal came from. And she's going to come and give us a presentation or 2 over the course of the year to answer general questions and also to talk about these specific funding things that are opportunities that are happening or maybe happening. So that would be an easy opportunity to get those kinds of questions answered. Anything else about childcare as a goal? Okay. Then we have homelessness as a goal. This is another one, kind of, very broad, very big. And, a lot of different directions it can go, but this is what I wrote down as a goal. We will monitor the issue of homelessness, hear updates, and consider uses of the Community Recovery Fund to address housing and homelessness as appropriate. We will monitor the city's encampment policy and explore ways to strengthen our partnership with the city. We will explore the idea of a wet shelter and/or a youth shelter in Tompkins County. When the County Department of Planning and Sustainability's housing planner is hired and ready, we will meet with that person to get the lay of the land and brainstorm ways for the Health and Human Services Committee to be more involved. So that's a lot of stuff right there. Any comments? Okay. I'm hoping these goals are broad enough to pull in anything that committee members feel like they really want to focus in on more. Okay, next up is the opioid settlement. And I wrote down as the goal, monitor the development of details concerning opioid settlement money and be involved in the use of that money as appropriate. We just got an update this morning. Some of us were in a meeting with the New York State Association of Counties, and they gave us a budget update. And so let me read to you some notes that I took down about the opioid money, because when I wrote these goals, we didn't know anything. And now we know some more, apparently. So first of all, the first money should be arriving in Tompkins County next month. And it is for Tompkins County government use. We should expect $190,000 for Tompkins County this year. And we will continue getting money for many years into the future, but the amounts could go up and down. There's no way to predict that at this time what those amounts will be. But this year, we're expecting $190,000. If I understood correctly, this is what was said about how we can use it. And it's possible that this might apply to some of the money and not others, but for now, let's use this as our guideline, unless Lisa, you understood differently. Half of the money we're going to get is unrestricted. And half of the money has to be used for eligible substance abuse programs. But that is to define very broadly, and it can include things like housing, public safety, and more. So, I mean, I think that's really great news. Half unrestricted and half eligible substance abuse programs. And then on top of that, there is something called the New York State Abatement Fund. And this is also money for substance abuse programs, and it's grant money. So we or if I understood correctly, private not-for-profits or the city or villages or individual towns can all apply for this money, or the county itself, from New York State to get even more money to use for basically new substance abuse services. So there's a lot in there. There's a lot of money, or a decent amount of money, and more on the horizon and more opportunities. Lisa, did that jive with what you heard?
Yep, you captured it all. Thanks, Dan. Yep, that's what I had too.
Great, thank you. Okay, any comments about our opioid settlement goals?
I do have a question, Dan. If one of us on this committee is working with a program that might want to access those funds, how does that work? Do we recuse ourselves from the conversation? How would that work?
So you mean an outside agency that might get some of these funds?
Yeah, so like, for example, okay, I'll just use myself because that's why I'm asking. So I run the LEAD program, and if we wanted to access any of those funds and I was involved in that program, how would that work for me pertaining to my role in this committee and I guess the legislature?
Yeah, well, the always safe answer is to consult with the county attorney.
Right.
And my guess is that would be a conflict of interest. It has to do with like financial gain, and also that if you're a prominent, that's not the word they use, but a prominent member of an organization that's getting money. But start with what I said. It's always safe to ask the attorney.
Okay.
Lisa, did you want to add any more to that?
I think it's safe to say, and probably any action, any vote that would be pertaining to that and to your other agency's request for funds, you would want to recuse yourself. But definitely great place to start would be with the county attorney.
I mean, there are things like if you're on the board of directors of an unpaid board of an organization that's getting money from the county, that may not be a conflict of interest, but if you're an employee, it's a different ballgame. So complex question. Don't know the answer. Other thoughts about the opioid settlement goal? Okay, the next goal I had was cannabis. The goal that I written down was we will monitor the situation and be involved in the rollout of the law as appropriate. And the background for that, very briefly, is that we don't even know if there's going to be any rollout this year at all. So we're just going to keep our eye on it and see if something happens that requires county involvement. Any thoughts about that? Okay. COVID, I already read before. Basically, we stand ready to jump in as necessary as a committee. Any thoughts about that? Okay, home health aides. As I mentioned before, I had a nice long conversation with Lisa Monroe. This had been a committee goal in 2020, and same old story, COVID hit and just obviously derailed the ability to pay attention to this at that moment. So that's why it's back. And so we're going to get a presentation and we're going to just keep our eye on the issue and do what we can to help promote more home health aides in the county. Okay, we also already mentioned public health and mental health department merger. We heard a big update today. Our goal is just to continue to monitor that situation, and Frank outlined some specific things where the county is going to have to take action, But other than that, we just want to stay informed and keep our eye on that. So any other thoughts about that? Okay, Department of Social Services. This was an interesting one. So we heard from Kit before about, I call it a heavy workload and some big departures in longtime employees that are going to be there. And so as we were discussing what the goals might be, we settled on something that's broad and kind of non-specific. So the goal that I had listed was explore how we can increase providing Department of Social Services services to those eligible. And in a way, for me, that's the goal of all our departments and all our programs, right? To widen the circle, to help more people. There are some specific things that were mentioned about DSS that maybe that they want to explore further, but we're going to need to wait a little while until DSS is dealing with the succession issues and some other things. Did anybody want to say more about the DSS goal? Okay, then the last two things were what I heard from other legislators just in the last 24 hours. One was, well, I can say it's from Rich John, who chairs the Public Safety Committee. And he said that an issue that's come up there for a couple of years has to do with trying to get an accurate count of overdose deaths in Tompkins County, and that it's a difficult number to get. And I guess I don't exactly know why. And that also, what committee would want to focus in on this? It could be public safety, it could be Health and Human Services. So, hey Frank, are you in listening range?
Yes, and we report overdose deaths from the medical examiner program every 6 months. It's on our website.
Okay, I certainly don't want to get into it, in a deep way right now, but do you have a reaction to what he said, that it's difficult to get an accurate count?
I need some context around that. I think the more difficult thing is the actual overdoses. That is challenging because many of them with Narcan availability, they don't end up needing hospitalization, or they do need hospitalization, but they don't seek hospitalization. And so the number is probably an undercount based on what we have. So that I would certainly agree with. But the number, if someone dies in that manner, it should be a medical examiner case. And we have those numbers because the medical examiner reports to me.
Okay, well, I'll tell you what, I'll have a little further conversation with Rich and with you, Frank, to try to get further at what he was getting at. Okay.
Yeah, and if there's particular info that he's looking for, or the committee's looking for, we're happy to try to help pull it up for you.
Thank you. Okay, so that was literally like an hour before the meeting that I got that email. And then yesterday I got an email from another legislator. And Frank, this one's going to be for you too. So stay in there. Thank you. So they wanted, their issue was the enforcement of the ban on the sale of flavored nicotine products. And, I don't exactly know how to think about that as a goal for the committee, but why don't I just start with you, Frank, and see what you have to say.
Yeah, there's definitely work to be done. Flavored nicotine products, vaping in general, it's an epidemic in our schools, and it needs attention. And I think, with the legalization of cannabis, we're going to see similar impacts there as well. So yeah, there's definitely work to be done around the issue of children getting access to tobacco, marijuana, and alcohol for that matter.
Okay. I mean, it's my initial thought is that this doesn't rise to the level of a committee goal, but I'm willing to be, discussed otherwise from anybody. So does anybody else have thoughts about either the overdose death one? I think we should not pursue right now. Any thoughts about the flavored nicotine products idea? Okay. I will, that'll be a follow-up conversation too, but I think I'm taking your silence to mean you kind of agree that maybe it doesn't rise to the level of a committee goal. All right. Any other thought? That was my whole list. Any other thoughts about the committee goals for the year? Okay, I just want to say, oh, go ahead, Veronica.
Sorry, just a lagging response in your previous question. I feel like would it make sense to have the enforcing the ban on the sale of flavored nicotine just sort of kind of looped in under the heading of the goal to monitor the cannabis situation? Because obviously it's a different thing, but Frank can correct me if I'm wrong, but it seems like that and say making sure that like cannabis isn't marketed to minors or whatever we have to do about that is sort of extremely similar. If that makes sense. I guess I'm proposing like, what if it was just sort of like an edit subtopic to this existing goal?
So maybe every couple of months we get a little report on enforcement updates or something like that. Is that maybe what you're suggesting or not really?
Sure. I don't know. What does Frank think?
Yeah, I mean, I think they're similar. I think the issue with flavored tobacco and vaping is it's the rules are currently in place where the cannabis rules are not yet in place. So it makes it a little harder from an enforcement perspective. But we are working, our health promotions division and environmental health are both working on the vaping / flavored tobacco issue because it's both an education issue as well as an enforcement issue. So, I mean, we're happy to report at whatever interval, makes sense for you all if you're interested in that. So just let us know.
Go ahead, Travis.
I was just going to ask, does the county's Coalition for Healthy Youth still exist? Am I
Yes.
that?
Yes, they do. Yes, they meet monthly, and they are vaping is an issue, and our department has provided some educational awareness training for providers and also for parents, and then with the legalization of marijuana, obviously promotion to youth and making sure that you limit access will be, I think, a big issue, and I would assume that there will be some grant funding that will come down for that will sort of rejuvenate and revitalize some direction. They have a website up. I'm sure that it's completely functional or updated, but it's called Weed Out, and just sort of to weed out the facts and to get that information out there. So that's something that we're watching and keeping an eye on as well.
Thank you.
Yeah.
Frank, is there an enforcement report that's issued or not really? Is it gathered in one place or not really?
Yeah, I'd have to check. Our environmental health division provides a monthly report to the Board of Health, and I'd have to check because it's part of our ATUPA grant, which is our tobacco program. I want to say it's in there, but let me double check and make sure, and I can point you guys to it if we are.
Okay. Well, let us then ask for some kind of update throughout the year. It doesn't have to be really frequently, but just maybe, twice a year. I don't know, I'm just making that up, but and we certainly don't want to make you do a whole lot more work, but it sounds like the information's there, maybe just gets juggled around a little bit.
Sure.
Is that acceptable, Frank?
Sure, to me, yep.
Is that acceptable to the committee members?
Yes.
Okay. Let's start with a twice a year report. Okay, any other thoughts about the goals? Again, I just want to say that for myself, this is not meant to be the last, this document is sealed and that's it forever. As things come up, then we will deal with them. No problem. Okay. There were a couple of budget adjustments, transfers for information purposes only. Did anybody need say anything about those? Okay. Anything else before this committee before we adjourn? Okay, it's 6 minutes to 5. Use those 6 minutes really well, and see you all next time. Thank you.